Hello and welcome to this video. My name's Kris, I'm an Australian GP, and today I come with my rant pants on. This video is really nothing more than me vocalising my frustrations at something that's recently happened here in Queensland and will follow suit in New South Wales, and by the time this video is up, potentially further states. And that is that the Queensland government has announced that everyone in Queensland is eligible now for a free flu vaccine via their GP or pharmacist. Unfortunately, we GPs, and I can safely speak on behalf of pharmacists here too, found out after this was released on social media. We had no prior notice of this, and that is unbelievably frustrating. I was in a consult with a patient who brought up and said, "Can I get my free flu vaccine?" So let's start talking about a bit of context. In Australia, because of our national immunisation scheme, there are some vaccines that are government funded. That is, you as the patient don't pay for them, therefore they are free. But because they're government funded, it actually just comes out of our taxpayers' dollars, which is fine. I am so here for that. For example, childhood immunisations, so babies' jabs up until the age of 4, then the ones through school, you don't pay for them because they are government funded. They are on the immunisation schedule. The flu vaccine is free or on the schedule for children under the age of 5, people over the age of 65, and those in between those ages with some specific medical conditions or scenarios such as pregnancy, cancer, significant heart disease, asthma. Basically, conditions that put you at higher risk of complications if you were to get influenza. I could sit here and rattle off a whole lot of other immunisations that people with medical conditions that I kind of listed before are eligible for, but this is about the flu vaccine. So we've got a population of under 5s, over 65s, and a few in between that already get a free flu vaccine. Because of how horrific influenza, particularly influenza A, is at the moment here in Australia, particularly Queensland, or at least in this context, I think that it's a great thing that we're now removing one of the barriers, which is the cost of the flu vaccine, to make sure that our health system doesn't go under. I feel like a broken record at this point. This is so similar to why we were, and still are, very on top of COVID vaccinations in primary healthcare. Because if we can prevent someone getting critically ill, and as someone who's recently had COVID and 3 vaccines, I wholeheartedly believe that vaccinating prevented me and my husband becoming really unwell. And I lost my train of thought because I just got a little bit up. But yes, so removing that barrier, fantastic. Flu vaccines cost about $22 for us to buy as a GP practice. So we charge about that. In my practice, we charge $20. I think we got, if you buy so many, you get it for cheaper or whatever. So we really don't make money off it. That's not what we're in the business for. We're there to provide a healthcare service. So we've bought hundreds of vaccines, and some clinics have bought thousands of vaccines for about $20 each to have in our stock, so that if a patient who is not otherwise eligible for a free government-funded vaccine, they can pay the clinic $20, get their jab, and head on out. Similar things happen in pharmacies, but again, I'm not a pharmacist, I'm not part of the guild, so I really can't comment on that. This announcement came out of nowhere. No GPs were in discussion about it. Our college only found out about it, so that's our governing body, I suppose, in a sense, an hour before it was released on social media. We had no chance to make sure we had enough stock, because there are some people who don't want to pay for the flu vaccine, but if it's free, they'll get it. So we have less stock than we need. We have been vaccinating people against influenza for 6 weeks now, thereabouts. We have noticed a dwindling interest in it because those who wanted to be vaccinated are now vaccinated, either because it was free or they get it every year. So we have ordered less, and we had started closing down our flu vaccine clinics. Again, I'm only talking in my experience, but I know other GPs doing similar things where there's no point paying staff, making sure that we've got everything on, earlier in the day, ordering more vaccines if there's no interest in it. So we've reduced our timing to try and accommodate that. Then all of a sudden, out of the blue, the government says, hey, you're going to vaccinate everyone for free now. And we had no warning. So now we don't have the clinic capacity, we don't have the staff capacity, we don't have the vaccines, and we have hundreds, if not thousands, of vaccines in fridges that we've already paid for. Anyone who got a vaccine before May 24th will not be reimbursed for it because, I mean, I liken it to if you buy something and then it goes on sale a week later, like some stores have a policy where you can take it back, but others are like, sorry, you missed out. What's frustrating is, as a GP, I am my own business. I'm an independent contractor. I contract out to the clinic I work at, and there's, quite a few of us, and we have a great team, and that's all well and good. But none of us are government employees. We follow guidelines, yes, that are government guidelines, like the Queensland Health Guidelines, and we refer to the public system regularly when we refer to Queensland Health-based hospitals. But for the government to announce and tell us that we are now doing this job is just infuriating. If this had been done better, I would not be making this video. If we were told a week ago, privately amongst our own group, so through our colleges or through the Australian Medical Association or something like that, that the Queensland government is considering or is going to make an announcement on this date that influenza vaccines are going to be free, so taxpayers, from this date to this date, and given us time to anticipate the announcement, make sure we had staff and make sure we were ordering enough vaccines, that would have been great. But that didn't happen. And this is a recurring theme that I've noticed, and that many of us have noticed, throughout the pandemic, is GPs will. GPs will just talk to your GP, do that. We're good, but we are not that good in that we cannot predict what's going to happen and we cannot continue to be beaten down. It's frustrating. We are very good at dealing with uncertainty. That's the hallmark of our job. We're very good at pivoting, as COVID has proven. We have gone from seeing everyone with coughs, colds, runny noses face to face to gowning and donning and doffing, to telehealth, to video conferencing, to having respiratory clinics, to vaccination clinics, to all sorts of things. We've done bloody well. I know influenza is not COVID, but realize that we're still in the pandemic. It may be not as significant right now, but we are still dealing with it. We have this expectation from a body of government that has no real control over us. It's exhausting being a GP right now. So if I can tell you one thing and give you one message, it's please be kind to staff at GP practices, from the receptionist to the nurses, to the cleaners, to the doctors themselves, to the pathology staff. We are dealing with so much. We always are. Everyone always is. But please don't call and say, I want my free flu vaccine, and get upset if we say that we don't have it, or that we don't know about it, or that we're not doing it, or anything like that, because we're trying our gosh darn hardest right now. Do I think it's a good idea? Yeah, I'm going to reiterate that. I think it's a great idea. Remove that barrier. $20 doesn't sound like a lot to some people for a vaccine, but for some people, especially when there's several people in the family, that's a lot of money. With how severe this flu season is right now, I think it's great. I just wish we had more time. And I wish there was clearer guidelines, because right now, just to give you a look behind the curtain, we don't know if we're going to get reimbursed for the vaccines in our fridges. There's been talk that we will, but how and by who? And if so, I had my ranty pants on today. I just wanted to give you an idea of what it is like to be a GP, because this is not talked about very often. Has this always been a problem? Probably. Has this been a problem that's been highlighted because of the pandemic? Absolutely. Am I biased because I've only really been a GP through the pandemic? Yeah, I had 1 year before it. So I appreciate that I probably have a very skewed point of view, and that this decision was probably not made lightly, and that there was probably discussions that I'm not privy to that happened beforehand. But as a worker on the ground, this was not handled well. So I am going to go, and hopefully in the next week or so we have more information about this whole flu saga. Please note I'm filming this on May 26th, and I anticipate I'll have this out the week after, which I believe will be around the 1st of June. I'm bad at calendars in my head, but yes. So if this video goes up and it's slightly outdated, I do apologise. I do cue my videos quite far in advance. Anyway, until next time, guys, do stay safe, stay healthy, and I'll see you in a video very soon. Hopefully a little less ranty. Bye.